The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between. Well, hello again, and it's Tuesday morning, and this is your host, Dr. Herb Bravo, and with me is your co-host, Dr. George Rogu from Long Island, New York, RBK Pediatrics. Today, we have the pleasure of welcoming Dr. Mark Lerner, who is a clinical school and forensic psychologist, author, speaker, and international consultant who focuses on helping people through challenging times and trauma. He will be talking to us about addressing the emerging psychological needs of children and adolescents. Hey, George, good to see you. It's Tuesday morning, and we're close to being in Houston at PMI.
How you doing, Dr. Bravo? It's Tuesday morning once again, and elevating great doctors. And today we're going to elevate Dr. Mark Lerner, a very dear friend of mine. I've known Mark since, my son's 24, 25. When our boys were 5 or 6, we used to coach the kids together in soccer. So we learned about each other. So Dr. Lerner is going to speak to us today about addressing the emergent psychological needs of children and adolescents, something that we know all too much about these days after the pandemic. So take it away.
Welcome, Dr. Lerner. It's a pleasure to have you on the show.
Privilege being here. Thanks for having me.
So we'd like to start asking people, why did you become a psychologist?
Oh, Herb, it's interesting. I didn't always want to be a psychologist. In fact, I didn't even know what psychologists were when I was a child. I guess I connected with the word psych, and I thought that they were psychic or people that could read minds. My passion as a kid growing up was playing the trumpet. And I would practice up to 6 hours a day. And by the age of 16, I was playing weddings. Problem was I wasn't a good reader, so classical was out, and I wasn't a great improviser, so jazz was out. So I was kind of limited to just playing ballads at weddings. My folks said to me, why don't you go to college, take some courses, find what you like, see what you connect with, and take it from there. And somebody told me to take an intro to this psychology class. And I sat down in the front of the room. Old professor walked in the room and just smiled at us and said, every day I go to the movies. I kind of paused. He then followed, I'm a part of people's movies. And that really hooked me. It resonated. Wow, how interesting. He grabbed me. I ended up taking every course I could with him, eventually became his teaching assistant, and then the rest is history in pursuing psychology.
Oh, wow. Wow, that's very cool. And then you started working with children and adolescents.
Yeah, shortly after completing my graduate studies in clinical and school psychology, I got a job working in a school district. So I was working with adolescents on a regular basis, then started teaching in a local university at SUNY Old Westbury. And then I started my private practice working with kids, many kids that George was kind enough to send my way from the practice, and really developed this special interest in working with children and adolescents too.
So what does a school psychologist do?
School psychologists, they're uniquely trained to deal with evaluating children, identifying learning problems, emotional problems, behavioral problems, providing intervention in school if necessary, possibly some counseling. So it's kind of diverse in terms of what we do in the schools and our roles.
Oh, it's I think there's a great need for that right now.
There sure is. There sure is. It's particularly in the role of stepping one step further than just being a diagnostician, but also addressing the emergent psychological needs of kids.
Does the school psychologist provide any therapy or anything in the hospital, or do they just pinpoint the problem and get the kid out of the school?
Yeah, we typically don't provide therapy in the schools. Rather, what we do is we provide supportive educational counseling. when a
Mhm.
child needs more ongoing care, especially when problems go beyond the school milieu and education per se into the family, we refer out to practitioners in the community.
Yeah, I just had a case yesterday of some 11-year-old girl. It sounded like some bullying or something, and she probably said some "I'm gonna hurt myself" kind of statement. All the red flags are coming up at the school, and they sent the kid home. Go to see your doctor.
And, the schools really, the professionals in school are really on the front lines in identifying kids that may exhibit problems and
Right.
connecting them with the right help.
Hmm.
Do you think that social isolation during COVID has hurt our young kids?
Oh, it certainly has. The number of people that mental health providers have seen, particularly young people, since COVID has increased dramatically. Um, Pretty much all of the mental health professionals I know, in fact, all of them that I know, are really at capacity in terms of seeing people, having waiting lists. It's very, very common. There's simply not enough mental health providers out there to meet the needs of our communities.
I think
And
finally New York State at least is understanding this because I
Yes.
believe as of February 1st, they're going to start paying for therapy and social workers and psychologists on the New York State Medicaid plans, which was something that was unheard of before.
Yes, the governor's been very helpful in recognizing that,
Yeah.
which is terrific and so needed.
Yes.
and do you think the elderly also suffer quite a bit? And I know you see mostly children, but do you think the elderly also suffered quite a bit from this isolation during COVID?
Yes, certainly I've seen it even in terms of my own parents and my in-laws. And it's been very difficult, even for facilities like assisted living programs, where there were all kinds of stringent rules of who can come, who can go, which really limited what they were able to do. They were kind of in a cocoon, if you will.
Yes.
Yeah, it's been very difficult 3 years. Now, it doesn't seem like it's over, and it seems like an eternity too.
Yeah, I think the rippling effects will continue to affect people for a while, especially the way children were educated. If you think about it, they were taken out of the classroom rather abruptly and went to this whole kind of virtual learning, if you will. And the majority of children that I saw in adolescents, young adults, did not do well with that.
Yeah, I think in the beginning it was a difficult choice, right? There was no protective equipment for the school employees, and it's not fair to ask employees to go into an environment that's dangerous to them without protection, right? You wouldn't allow a construction worker at a building to go in without hard boots and a hard hat. The government wouldn't allow it. But then it maybe was overdone. There's a point where there was vaccines and there were protective equipment, and we still in some states kept the schools closed. And I think the kids just weren't capable of dealing with that.
Well, this is something that was certainly very new. So
Yeah.
we haven't experienced it before, and the repercussions continue.
Well,
Yes.
how did you become interested in working with children and adolescents during a crisis?
Well, I was always interested in crisis intervention in terms of what's done in the aftermath of traumatic events. But I also started to cultivate a very unique interest, and it really follows the basic principles of medicine, the golden hour, if you will, the first things that you do, airway, breathing, circulation. What is the first thing that we can do that could potentially help people from a psychological point of view to address acute problems and prevent them from becoming chronic stress disorders? So I ended up developing a protocol to address the emergent psychological needs of people of all ages, I actually spent a year riding along with the police in police cruisers, supervisors, police ambulances, and did the night tour while working during the day as a school psychologist. I worked from 7 at night to 7 in the morning, riding along and really seeing opportunities to say and do the right things with people from a psychological point of view and not do the wrong things, like arriving on scene and saying, ah, it could have been a lot worse. Well, something like that certainly doesn't help somebody to feel a sense of empathy right at that moment. So I ended up developing this acute traumatic stress management model and took it really around the world with its utilization of reaching people early.
Oh, wow. It's always interesting how some people, every human being reacts differently to stress, and how some people will end up with post-traumatic stress syndrome and some people have post-traumatic growth. And how do you think the program makes a difference, or you think it's more innate in your own biology?
Well, it's the old nature versus nurture. There's always going to be both factors contributing. But one thing that I learned in working for the United Nations as a consultant and training professionals around the world in Paris was that when we had professional psychiatrists from different parts of the world, they were talking about the different kinds of traumatic events that were impacting kids, adolescents, adults. And one of the things that we found that was so fascinating is no matter what the event was, and in other countries, very different events that they were experiencing than we do on a regular basis. For example, abductions in some countries are commonplace. But the same fundamental human reactions are seen among people. And I found that fascinating because that really tells us that if we rely on evidence-based practice in reaching people with timely information, guidance, practical strategies, and support, we can make a difference in helping people early on.
Well, what is the most important things you learn about working with children?
Well, one of them was what I've learned from Dr. Rogu, who said this a number of times. Children are not little adults. When we work with children, we have to be mindful of that developmentally in terms of their needs. One of the things that I've learned with children that is so critical is tell children the truth at a developmentally appropriate level, while also taking into consideration the unique attributes of that child. If a child tends to be a little bit more emotionally sophisticated, if you will, and able to talk about emotions, you may be able to share a little bit more than the child that can't. So recognizing the unique needs of kids is so critical. I also think, and I say this to people very often, children are like clay. They're malleable. We can work with them, we can shape, we can change. And what happens to clay over time? Clay gets hard. And it's not when people are adults that we can't make changes. The problem is those changes to that clay now become chiseling away, and it becomes much more difficult. So there's a tremendous opportunity if we can reach children in the earliest phases of challenging experiences and address their acute needs.
And so in your practice, how do you go about creating this change? Because change is very difficult, not only at the individual level, but also at the, at the bigger organizational level. What have you found that works in motivating people to change?
Well, the first thing that I do is I always work to get the parents on board. I know that if I try to work with a child initially and the parent isn't on board and supporting the process, I'm going to always have that in the background. So I immediately meet with parents initially. I get a good solid history. I form a good rapport with them and help them to see that they can be an integral part of the process. Then what I do is I meet with the child subsequent to meeting the parent, and it all comes down to rapport. It all comes down to that relationship, exactly. Dr. Rogu. It's all about connecting with the child and being that special person in the child's life that they can go to and know that everything that they say is okay, will be heard. They'll be met with empathic understanding. They'll also receive some strategies, evidence-based cognitive behavioral strategies that they can then take and utilize in their lives to address the problems and conflicts they're facing.
You know what I've seen? Cases that were referred out to like big universities and centers. You get the teenager that has an issue. They go to the psychologist or the social worker, and the parent is not involved. It's they drive the kid. The kid goes in the consult room. They talk to their counselor, and then they leave. And the parent has no idea of what's going on in that room. How is that right?
It's not right. And in my opinion, it's a missed opportunity because
Right.
if we can get the parents to reinforce the process, I'm so glad that you're talking to Mark. I'm so glad you have this special person in your life you now can turn to. They're already validating the process and helping the child to know that they're doing the right thing. And they're also teaching them a life lesson.
Right.
Let's face it, if we can get children to start talking about problems and sharing beyond texting and beyond technology, face to face, get them doing this early on, they're adapting and they're developing coping strategies that they can utilize interpersonally as they grow older.
Back to relationships and connections.
Exactly.
Yep.
And you touched on something that I think it's a two-edged sword, the texting. It seems like less and less young people are able to have a conversation and listen to someone else. They're constantly with their heads down on text. And even if they're with other young people, they're texting each other at the same table. Do you see that as causing harm to kids too?
I do. As I've often said, technology is developing faster than the human animal can adapt to it. I was at the mall this past weekend and I noticed and pointed out to my wife how many people were walking and texting. This isn't specific to kids. This is everybody. We're in a world right now when something bad happens, the first thing we do is return to technology, return to the keyboard,
Right.
and we don't talk to people face to face like we used to. And this is all happening so quickly. And that's one of the things that I welcome with the therapeutic milieu, because that psychotherapy office is a sanctuary where once again we can come back to sitting together, as Dr. Ogu points out, and really focusing on that relationship and hopefully developing tools they can take and use in their lives.
Yeah. But these tools and things like Zoom, for example. I mean, you do any psychologist or psychiatrist or whatever, whoever's providing counseling, everybody's doing telemedicine. They're no longer seeing them in an office like yours.
Everybody isn't. A lot of people are. And there are times where I'll see, for instance, students that go off to college. It's wonderful that I can continue to maintain contact with a student up at SUNY Buffalo by, Zoom. However, as we both said to each other, in fact, just the other day when she was back for winter break, she commented, "It's so much better being here in the office
It
and
is.
seeing face to face." So
It is.
there's nothing that's going to replace that face-to-face interpersonal interaction.
Yeah, I think it has to be a hybrid model. We're going too much to this telemedicine stuff, and it's no good. You have to have in person, some telemedicine for convenience. I think that's a sweet spot.
I think that's well put. I think that there has to be a good balance.
Right.
Yeah, it's they've even coined a term, right? Phubbing, when people are in a social situation, instead of engaging with their friends, they're texting and doing stuff on their phone. And it's sad. You see it in adults too. They're not enjoying the moment. They're too busy trying to catch up with other stuff on the phone.
But all
Yes.
this technology stuff, it's starting in the schools and the universities. I mean, your kids finished college. I think they had the hybrid. They had in-person school, but probably towards the end of it, it was all online. I don't know how I feel about that all online school. I did an online MBA. It was good for me because it was convenient. I did it when I wanted to. I didn't have to leave the office to go to a place. But for a college kid, they lose that. Let's go to class. Let's sit down. Let's take some notes. Let's interact with the professor. Let's ask a question at the end of the professor. Like, we're going to a conference next week in Houston. I'm excited to go talk to people, to engage with people, to sit in the front row, to listen to the guy talk about whatever he's speaking about. You know, can you get this with online stuff? You can. For example, this whole podcast, the Pediatric Lounge, I've never met Herb in person. Do you believe that? Just through Zoom, but we will meet next week in person and shake hands.
But even the way you look forward to that says
Yeah.
something.
Yeah.
You recognize that it's going to be different,
Yeah.
and it is. And virtual will never take the place in the mental health field, at least, of being face-to-face in session.
Right.
It certainly is very challenging times, and I don't know how do we create more mental health professionals to meet the need of the population right now. It's very difficult to find a therapist for a kid.
Yeah. I guess people are going into psychology these days, right? Is it one of those fields that people will go into, or?
They certainly are. People are pursuing psychology and social work and counseling and other related fields, and obviously psychiatry as well. But as you point out, there's simply not enough people to meet the needs of our communities.
Right, right.
It's one of the things that I'm invested in working in now.
And it's not like you could produce one in 6 weeks, It's what is it, 8 years of work?
Well, it really depends on the type of program. It depends on the individual going through the program, how quickly that they do it. But as I've said to people that are pursuing psychology, and they said, it's just going to be too long to get that doctorate, I always say the same thing. Not all that time is in a classroom. A lot of those credits will be subsumed in clinical internships and research settings. So it's not all in the classroom. And quite frankly, it's enjoyable. It was a great process.
It is, but it takes time. So we need them now.
Yeah.
There is no microwave to make either more doctors or psychologists. It takes 6-8 years to get a psychologist with a PhD. And we need them now.
We are, and this is one of the reasons that I've recognized this need. And I thought to myself, well, how do I contribute? And I actually developed a concept where I call it the greatest career. And even I wanted to get it positioned high in the search engine optimization. I said, what will people search if they want to go into the mental health field? Well, maybe they'll search the greatest career, or I can get other people interested in this career, in this field rather, by searching the greatest career. And I got the URL, thegreatestcareer.com, and it really tells the story that I'm telling you right now of somebody that went through this process of becoming a psychologist. It could be anywhere in the mental health field. And my goal is to stimulate the interest of young people to pursue a career in the mental health field, because I absolutely love it.
Well, you're really good at it. So I guess you're becoming a mentor to a psychologist.
Well, I'm trying to do that. I'm trying to help people to see the diversity. And as I like to say on thegreatestcareer.com, the many hats that we can wear. People have this impression that a psychologist is somebody that sits in the office all day long and listens to people's problems. Couldn't be farther from the truth. I handle all different kinds of situations, that from evaluating candidates for the NYPD to all kinds of diverse things that are just so much fun to do and enjoyable to do.
Yeah. I remember, you hear about all this physician burnout and stuff like that. I had asked you once, do you think like a physician needs to talk to a psychologist just for fun? And you told me it's a good idea. So I visit you every couple of years. And usually you tell me what the answer is that I already know. You just tell me turn around and go do it. But if you think about it, even in Star Trek, you had the captain that always had the counselor that told him what to do. So the physician is like a captain, and he needs somebody to help him when he's deviating off course, to help him put back on course. So I think physicians should have. They're calling them coaches these days, but I'm seeing that a lot of them are like physicians that went through a problem, got through the problem, and now they think that they can tell other physicians how to avoid that problem.
Well, the responsibilities of physicians are enormous. You don't need
Right.
me to tell you that, and especially in working with young people and young children. The idea of knowing that there's a place to go and to talk and to process your feelings and to come up with some adaptive, healthy coping strategies makes good sense. I find that the answer ultimately resides in the doctor themselves. They know the answers. It's about helping them to see, to look inside and find those answers and implement them.
Yep.
Yeah, I do think that coaching in groups are very helpful, not only for doctors, but for patients too. In the sense that, again, we are still herd animals. And when you have a community, even it's better when you can do it in person, but time and distance doesn't allow it for us to do it in person every time. But that support of a community and that sense of belonging gives you some peace, even if you can't resolve the problem. It's a very important part of human nature that we've forgotten.
Yep.
So what are you doing nowadays? What are you focusing?
Well, nowadays I'm continuing to do what I always loved, and that's going to the movies every day, being a part of people's movies and helping people to see that they really do have the answers inside of themselves. In working with populations of people who are hurting, I've learned that if people can learn to take the pain from adversity, one of three things tends to happen. Many people kind of get stuck. They don't do anything particularly bad. They don't do anything great, but they just kind of exist. They go through the days. They often turn to people like me to try to get them out of being stuck or unstuck. It would be a good title for a book, actually, Unstuck.
Unstuck.
But I've thought about that one. But there are also people that are taking that energy and they're using it in very destructive ways. Drinking, drugging, quitting, dropping out, in terms of children misbehaving, acting out, oppositional, defiant behavior, etc. It's like dominoes falling down. But there are also just as many people who take painful energy from adversity and they use that energy to propel themselves to do just amazing things with their lives. And that's what I try to do every day, to help people to harness the pain of what they've been through and utilize that as their magic.
Interesting.
Yep. The difficult part there, and we see it a lot in the examiner, is change is very difficult. And no matter how much of a relationship you have, how persuasive you are, until the individual doesn't want to change, their journey doesn't begin. And I don't know any quick way of clicking that on so that, that the person understands they need to start this journey of change.
There's a saying in my field that the person in the office isn't usually the person that needs the most help. It's the person back at home. The person in the office has already made a commitment to wanting to do something about their problem. So I see people who avail themselves to mental health support as already taking a step ahead in confronting the problems, talking about them, facing their problems, and ultimately making constructive choices in their lives.
But what do you do with that one that comes in and they're stuck? And sometimes it seems like they don't want to be unstuck. They like to wallow in the self-pity and the constant, I'm just here. How do you get them to see that there is so much of a better life if they just listen to you?
Well, here lies evidence-based practice, where we can turn to some of the techniques and tools and strategies, such as cognitive behavior therapy. I may help people to see that what you're saying to yourself on a regular basis is keeping you in this kind of stuck place, and helping people to see that just as your thoughts can turn in a negative direction or perhaps keeping you stuck, they can also propel you to do something. So thoughts affecting how we feel is such a very big part of the latest and greatest in the mental health field in terms of evidence-based approaches. It's really showing so much efficacy.
And do you think all these medications, we're medicating kids like adults at an early age. Do you think they're helpful? Do you think that they're becoming crutches for some of these kids?
Look, there's a segment of the population that are truly benefiting from medication, without a doubt. We've seen that in our practices, whether it's pediatrics or as a psychologist. But I think in general, there's an over-reliance on medication as opposed to, as the first line of helping people, let's try to give people some tools and strategies and this relationship that we're talking about to affect change.
Yeah, yeah, it's you just don't know which way to go, right? Because someone's in pain and it's easy to write the prescription and see if they can't get better. But then when do you stop the medication?
But that's a really good point. When you talk about the pain, the medications that we typically turn to when somebody is experiencing emotional pain or emotional distress, as they take time, like the SSRIs. They're not instant quick fixes. We don't want to go to medications like benzos, where people can be developing reliance on these kinds of medicines. So there's really no quick fix from a pharmacotherapy point of view. That's why getting people talking and being monitored and followed closely by a caring mental health professional makes real good sense to me.
Yes, yes. Again, the barrier there is there's not enough of you to try to get one of these kids that's hurting into a psychologist today, and not only into a psychologist, one that does evidence-based or dialectic therapy or cognitive behavioral therapy. It's very difficult, and they are just like in medicine. There's a lot of psychologists that have a very good reputation, 5 stars in Google reviews. But they don't do evidence-based, and people are with them for 5 years every week, and they never change. They're more of a buddy that people go talk to. And it's like, it's not what my patients need. They need change. It's been difficult, I think. Where can people reach you if they want to know more about your programs and this new way of helping people into psychology?
Well, the easiest way to reach me is simply by my name, marklerner.com. And on that website, all the different things that I've done, including links to the greatest career, where hopefully I can stimulate more young people to pursue a career in the mental health field.
Do you have students that rotate through their clinical rotations with you?
No, I don't. We don't have that in the mental health field in private practice. That's more of a, if you're working in clinic settings or
Right.
hospital-based care, but not in private practice. It creates confidentiality issues.
What's so confidential compared to a hospital? It's the same thing. The
Well,
confidentiality.
it's one of the reasons that people pursue private intervention with a private psychologist outside of a clinic or a hospital setting is very often they want the confidentiality, the privacy,
I got
the
it.
knowing that I go to this place that nobody needs to know I go to. Whereas when you go into a teaching facility, you know that part of the program is there may be
I
people
understand.
sitting in. That doesn't mean, I had an intake yesterday for a candidate who was trying to become a New York City police officer. And I had a social work intern sitting in with me and watching that process and learning how
Yeah.
it works. But that's very different though than therapy.
Yeah.
gathering that kind of information from somebody who's trying to show me how healthy they are to get on the job is a little different than somebody coming into therapy who's really hurting.
Yeah, because I think you're a unique psychologist. They don't make them like you, Mark. And I think you have a good story to tell, and you should share it.
How so? What do you find that he's evidence-based, or that he's done so many things?
Everybody's evidence-based. Mark is different. He's in private practice. He does everything. He adjusts. He pivots. He does whatever it takes to get the job done. And I think young kids that are going into psychology, they just think they're going to go to a place, a school, and talk to some sad kids, or open up a private practice and talk to some, wives that are not happy with their husband, and they're depressed. And it's not that. You don't do that. Mark does traumatic stress, and it could be any kind of traumatic stress.
And this comes back to what I talked about earlier, thegreatestcareer.com, where I really am trying to help young people to see the many hats, so to speak, that a mental health provider can wear. We can do so many different things to make a difference outside of even the sanctuary of the therapist's office.
Right.
Yeah.
Now you got to change the world of psychology. I think you got to get out there. People got to come and see the Mark Lerner, see what he does. He's not just a psychologist. He's more than that.
Thank you, George.
Well, this has been a very pleasant conversation.
Thank you, Mark.
Thank you so much. We hope to see you again in the podcast.
Absolutely.
And
Stay
keep doing
here. Thanks for having me, and thank you for doing what you do to make a difference out there.
Yeah, we're trying. We're trying to keep the voices out of and elevate great physicians and doctors and whatever you have out there that are in private.
Yeah. The world needs a lot of community right now.
Right.
Whichever way that can come about.
Okay.
We sure do.
All right.
Thank you for listening. This has been a production of the Pediatric Lounge. On the show notes, you will find links to our co-host and other important notes, as well as a timetable of the topics discussed today. Don't forget to follow us on social media and subscribe to wherever you listen to your podcast. Leave us a great review, as it helps us greatly. In the meantime, we will see you next week. The Pediatric Lounge. The conversations are not intended as medical advice, and the opinions expressed are solely those of the host and the guest.